Good evening, all. Today, I am going to tell about how to evaluate a follow-up imaging in low-grade glioma after post-radiation. Usually, we just ask for in low-grade glioma for after 3 months first imaging and every 3 to 6 months further imagings. And when patient is required a symptomatic, we can ask for the proper imaging. In this imaging, we should ask for a T1 contrast, T2 flare, DWI and ADC. If there is a lesion, we can go for a MRS. So in the first step, let's evaluate the T1, then second step T2, then third step DWI. In the first in T1, you have to see the post of bed. This is the post of bed. There is a the CSF intensity, there is no abnormal finding. If you see the corresponding images of contrast, there is no contrast image. Grossly, we can tell there is no tumor or high grade tumor or high grade transformation. In the second step, you have to evaluate the T2 and T2 flare image. If you see the T2 and T2 flare image, as you know, the CSF looks to the CSF anywhere it looks to see all are white or bright or hyper intensity, and you have to look for any hypointensity area inside the hyper intensity. If you see the corresponding T2 flare, there is a all the post op cavity and the ventricular oozings you can see, and these are the normal hyperintensity area. So if you see the T1 and T2 flare, there is a in T1 there is no enhancement, T contrast there is no enhancement, T2 flare there is no abnormality or hypointensity inside the hyperintensity area. Third step, you have to do the DWI and ADC map evaluation. In DWI, if you see the post-op bed looks bright, but a margin looks bright and inside the hypointensity area. So if any lesion or any area which looks bright in the post-op bed, it does not most of the times we call as it is a diffusion restriction. But here, this is the CSF intensity that is looks bright and it is called T2 sign. So T2 sign and CS normal intensity should not be get confused. And when there is a confusion, you have to see corresponding ADC map. If you see the ADC map, the post-op bed and the CSF area looks similar intensity. And usually, if it is bright in the DWI, if it recurrence, it should be corresponding. It should be hypointensity in ADC map. So it does not matching as a recurrence or residual. So mostly in this follow-up image, there is no high grade transformation or there is no low grade recurrence. And this area, confusion area, if you see DWI and ADC map, if you see, though the margin is looking bright, it is called T2 sign, it is not recurrent. And if you have some doubt, you see the corresponding ADC map where you see the similar intensity of the CSF cover ADC map. Usually, those are bright in recurrent tumor with bright in DWI, usually hypo in ADC. So according to this patient does not have any recurrence or residual. So if there is a recurrence, you can do the MRS in the fourth stage. So this is the thing how to evaluate. Thank you very much.